Welcome back to Bahamas at Sunrise. So, vascular and interventional radiology, also known as IR, represents an exciting new frontier in pain and disease treatment, and it's available for the first time in the Bahamas at Family Medicine Center. So very pleased to be joined this morning by Dr. Mikhail Higgins. He's an international radiologist, IR, and a Family Medicine Center. Good morning, Doc. Welcome to Bahamas at Sunrise.
Good morning, Simon. Thank you so much for allowing me to be here. What a pleasure it is. Really grateful to you and your team.
Yeah, and as I can see that you're already in office, so you're getting this Friday off to an early start, maybe, or maybe this is just normal for you.
Absolutely. Well, the early bird catches the worm, so we're here to do what we need to do. So early morning is always a good place to start.
All right, good stuff, good stuff. So, it's the first time I think that we're doing this. What exactly does that mean when we talk and when we say vascular and interventional radiology?
Yeah, so we'll just shorten it to interventional radiology just for the sake of our public here today. Okay. And so interventional radiology is actually a field, a subspecialty that was developed in around 1964 by a gentleman by the name of Charles Dotter. And it really started with an index patient, Laura Shaw, who had sort of gangrenous toe ulcers at Oregon Health Sciences University. And she was told by her surgeon that she needed an amputation. And, this 80-something-year-old woman said, no, you're not going to cut off my foot. And essentially, she just kept pushing. There has to be another way without sort of getting an amputation. And so he referred her to this gentleman, Charles Dotter, who essentially did a serial dilation technique where he sort of went into her artery in her leg and sort of serially sort of dilated it to the point where this blockage ultimately became sort of open and she was able to restore flow and perfusion to her foot. And so a few weeks later, he imaged it again with contrast and demonstrated it was still open. Several weeks later again, and this woman did not get an amputation and she was able to essentially sort of die on her own sort of 2 feet. It wasn't until sort of recently in 2015 where after sort of quite a number of procedures that sort of kind of entered the armamentarium of IR where it became sort of known as sort of offering a unique paradigm, and the American Board of Medical Specialties sort of granted us unique status as its own specialty. And essentially what we deal with are offering minimally invasive image-guided non-surgical alternatives. And of course, there have been procedures that have sort of given us some notoriety. In the early 2000s, Condoleezza Rice notoriously had her fibroids treated by the same procedure I offer, and the following day she went back to work. Dick Cheney had aneurysms behind his knee, operated on by interventional radiologists with 2 small incisions, went back to work the following week. And of course, most recently, Melania Trump had an emergency where she had a benign tumor that was essentially being ruptured, and she had it embolized minimally invasively by interventional radiologists. So what we offer are sort of, again, non-surgical alternatives to common disease entities that we treat on a daily basis.
I mean, listen, I'm looking at you and you look like you're 16, but you're talking like you've been around a long time, Dr. Higgins. You called off a list of names, but you recently did, from what I'm told, a groundbreaking uterine artery embolization procedure on a Bahamian woman. Speak a little bit about that.
Yeah, no, it's what a blessing it is to be able to offer care to our Bahamian people and particularly our Bahamian women. And I just got off the phone with that patient last night who is now in Mexico, in Tulum, enjoying herself. But she had a wonderful procedure. And I mean, first and foremost, I just want to start off by thanking the team at Family Medicine Center, the amazing team at Doctors Hospital, the team at Anesthesia Associates Medical Group who provided sort of support, who are my partners in this sort of offering this paradigm of care. But the procedure went swimmingly well, of course, being the first time that something of this nature was offered at Doctors Hospital. I mean, everybody sort of kind of stepped up and sort of brought their A game. And, our index patient, who obviously is sort of kind of self-declared who she is, so I'll sort of use her name, Ms. Sands, she essentially did very well. The following day, she was discharged. Of course, during our procedure, we offer sort of blockages to the blood supply, and that results in sort of ischemia, death to the tissue. And so there's some cramping involved. And so once we sort of manage that sort of post-inflammation cramping, over the course of 3-4 days, everything sort of returns to normal. And again, as I mentioned, she's now, from the standpoint of our procedure, doing well, and of course, enjoying a trip into Tulum.
Is that primarily dealing with blockages? I'm looking here and it says uterine fibroids as well in terms of the endovascular management of it. It sounds like big words, but it's simplest description. You go in there, you look for blockages, and you remove them.
I'll sort of take a step back. So what we do is we essentially anything that is abnormal in the body has recruited blood supply from what's normal in the body. Okay, so what sort of essentially the fibroids are just muscular benign tumors that grow either inside the walls of the uterus, okay, or on top of the uterus. And so what I do is I go through a little blood vessel, either in the groin or the wrist, most commonly the groin, and I identify that blood supply to the fibroids. Okay, that blood supply that it essentially recruited from the body, and then I block it off. Okay, I do that. Okay, that's my job. Is it shouldn't be there. It has sort of vessels that it's recruited, it's stolen from the body in order to sustain its life, and I sort of block that off. And what then happens is now, again, if it has no blood supply, it has no life, it then dies. And essentially the primary symptom that women present to me with for this treatment is bleeding. And so all that bleeding that's associated for these sort of, let's call them parasites, which is kind of what they are, is completely removed. And so once they sort of die, women sort of return back to their normal menses, their normal period, which usually is sort of what they experience in high school. So that's usually sort of what the case is for women that I treat.
Yeah. How would you know that you need to do a procedure like this?
Yeah, so the beautiful thing about it is women know what they're going through. Okay, women know, talking to their colleagues, their friends, their loved ones, when they are sort of an outlier as relates to their experiences. If they're having sort of essentially increased bleeding month to month, okay, well, the woman I just saw in clinic, she was using Depends 4 times a day. She was using pads in addition to Depends during a period of lasting 7 days. So for all intents purposes, that is not normal. And so women know that, they self-identify, and then of course they may have other symptoms that may be related to the bulk of the fibroid. Maybe they have intercourse and they have excruciatingly pain and they know it's abnormal, or they have constipation. Another woman I saw, she was having 1 bowel movement a month, and it was because of the fibroids were blocking off her rectum. It was just sort of throwing it sort of weight backwards. And so, of course, she would try to pass a movement, and she wouldn't be able to. Or, the alternative is sort of the fibroid is sort of projecting anteriorly. And so what ends up happening is their functional volume of their bladder is sort of compressed because of the fibroid. So in that situation, women just sort of present to me and say, hey, doc, this is what's going on. And then I sort of kind of put the pieces together. We do the imaging, we prove what's in place, and then we treat the woman if it's necessary.
So mostly women, or?
Well, women are the ones that have uteruses, and uteruses are the ones that have fibroids, yes.
But for this interventional radiology, mostly on women or only
no. So I apologize. Sorry, I was just sort of focusing our discussion on fibroids, which of course, is something that I'm really focused on in the Bahamas because as many people know, it's, this is something that's endemic to Black women. And so we have a disproportionately increase in fibroids in the Bahamas. Okay. And so for me in offering care, I don't tend, there's many things that I treat. I treat stroke, I treat sort of, malignant tumors. I treat varicoceles, I treat enlarged prostates, I treat sort of hemorrhages that occur in the setting of trauma, that occur in the setting of gastrointestinal bleeds. But for me, it's all about, if you have solutions, you don't offer the solutions that you want to offer, you offer the solutions that are needed to the problems that exist. And so in conducting my needs assessment with my team at Family Medicine Center, with my team at Inner Health, we've identified that fibroids is the probably most sort of vexing concern in the Bahamas. And so I want to meet the needs that exist. But there are things that obviously I offer that over time, as we develop sort of the clinical paradigm in the Bahamas, we will begin to roll out.
All right, man. Listen, I just feel so much more enlightened this morning. It's been a pleasure just meeting you and interviewing you, Dr. Higgins. Obviously, persons are watching this and they feel as though there's a need to contact you. They can do that at Family Medicine Center.
Absolutely. And I would certainly encourage folks to do that. And and it's really heartening to hear, even the past week, and sort of opportunities that women have felt that they have sort of now gotten to essentially present themselves to Family Medicine Center to just be treated for something that has been sort of just ailing them for years. And so I appreciate folks like yourself, your team at Bahamas at Sunrise, for just offering folks this opportunity to be informed and to know that we're here to support them.
Absolutely. Listen, thank you so much, Dr. Mikhail Higgins, interventional radiologist at Family Medicine Center. You're watching Bahamas at Sunrise. We'll be right back.